Hey guys, my name is Kelby Hightower, and in this video, I'm going to walk you through three major tips if you are looking to choose a Medicare Advantage plan, to enroll into a Medicare Advantage plan, or you're looking at maybe a Medicare supplement option, and you're really leaning towards a Medicare Advantage plan option. I'm going to go over the three major problems that most people create for themselves if they are not guided correctly and educated properly when choosing a Medicare Advantage plan. If you know these three things, it's going to eliminate the confusion, eliminate the frustration, and enrolling into a Medicare Advantage plan can be a great option for you if you so choose. In this video, I'm going to be diving into those three tips. Stick around, I'll see you in just a moment. Hey guys, my name is Kelby Hightower with Medicare Hub. I'm the principal broker of an agency that specializes in Medicare health plans. I want you to take a second, if you haven't already, to like, subscribe, and then share our channel or our content. This video would be a great video to share if you're talking to your friends, people that are 65 and older, and they're looking at Medicare Advantage plans as an option. I'm going to be covering today the three things that will eliminate most of the frustration that most people experience enrolling into a Medicare Advantage plan, and they don't understand these three things correctly or have somebody explain Medicare to them and in Medicare Advantage plans and how the coverage works. These three things are the real catastrophic issues that most people experience. If you understand these three things, understand how the plans work, then you're going to understand choosing one of these plans can be a great option. I would say if you understand these correctly, going into a Medicare Advantage plan can be a perfect fit for a lot of people. Not always the best fit for everyone, but it is a great option for those that understand these. And let's dive into these. So the first thing is network matters. You know, your primary care doctor, your specialist, maybe a hospital that did a knee surgery 2 years ago, they are very, very important to me, to you, to anybody that's ever accessed care. If I'm a healthy person, but if I was going to access care and I have a doctor in mind and I'm enrolling into a health plan and that doctor does not take that health plan, I don't care how great the benefits are on that health plan, I would push it aside to find a health plan that's going to allow me to continue to see my primary care doctor, a specialist, a hospital, really what is surrounded you in providing care. Maybe you're turning 65 or maybe you're 75 years of age and you're watching this video, and maybe you've had a catastrophic health event occur. Maybe you had a heart attack. Maybe you have an ongoing health condition or a disease or an illness or something that's chronic that you're having to have managed by your primary care doctor and your specialist. One of the major things you need to understand is if you choose a Medicare Advantage plan based on the network, and if you're in a metro area where there's a robust network of primary care doctors, specialists, and hospitals, if you have a licensed agent that's doing their job correctly, they're going to verify who your doctors are, your specialists, the hospitals, and the access of care that you want, and ensure the plan that you're enrolling into is going to take that health insurance or Medicare Advantage plan that you're enrolling into. That is very, very, very extremely important. A lot of times if you choose to pick up and call off of TV advertisement, what happens is you get routed into a call center, and that call center person has been trained for about 3 to 6 months, and they're answering questions. They're doing the very best they can. They just don't live in your area. They don't live in and doing this year round for several years. We have over 17 years of experience, thousands and thousands of Medicare beneficiaries we've enrolled into health insurance plans, and we've done a lot of Medicare Advantage plans in certain markets, and we understand the importance for that person to enroll into a plan that's with their doctor, their specialist, and their needs according to what their access of care. Then also looking at the longevity of what's going to happen in the future. Meaning like, hey, if your care changes and you're like, hey, if I have a neuro issue, I want to be able to have access to Vanderbilt Hospital, or if I have this going on with my heart again, I want to be able to have access to this hospital. We would typically guide somebody towards a Medicare Advantage plan if that's what they're looking for, once they understand their options and understand how Medicare works, and they're looking towards a Medicare Advantage plan of what's going on right now, but also potentially what's going to be going on that year going into that plan. Now, understand each year and every several years, sometimes Medicare Advantage plans will have disruptions in their network, and that means you may have to change from Plan A, Medicare Advantage plan, to Plan B or Plan D or whatever the plan is. So it may be Cigna and you're changing to Aetna, or Aetna to United Healthcare, all these different Medicare Advantage plans based on the need and access to care. The beauty of that is you have a couple times throughout the year that you can do that. you have basically a blocked out time of 6 months. The open enrollment period, October, November, going up to December 7th, you can change your Medicare Advantage plan effective January 1st. So if there's network issues going in through the year and you see there's going to be a problem to access care, you would change during that time period. Start January 1st, you'd have a new card, new plan, go to your doctor, go to your specialist, go to your hospital and not have any issues. The second option is from January, February, all the way up to March the 31st, you have what's called the open enrollment period right now. And that allows you to change from one Medicare Advantage plan to another Medicare Advantage plan. Again, there's access issues with going to a certain doctor. You realize that. You call and you say, hey, this is my problem and this is the solution towards that problem. Again, identifying what your problem is or your concerns and problems could be, and then providing a stable solution is going to always be the approach that we take. So migrating into a different Medicare Advantage plan. Now, there's other special elections throughout the year, what they call lock-in period, from April all the way up through October, and it can be through December. You have this lock-in time that if you don't have a special election, you can't change plans. Well, the alternative is you go, if you're like, hey, I just don't want to look at Medicare Advantage plans at all because of those network potential issues, then you can always stay on original Medicare and then enroll into a Medicare supplement. We can help you with either one, and reviewing and analyzing your needs and then explaining this potential issue is huge. The second thing is understanding plan costs, premiums, deductibles, copay, and out-of-pocket max. If you enroll into a Medicare Advantage plan, you're going to have a lot of zero cost for preventative services. Typically, access to primary care doctors now are $0 or $5 or $10. It's nothing hardly. Access to specialists are going to range from $10, $20, $30, $40. Sometimes a plan may have a $50 copay, but typically it's $10 to about $30 in copay to access specialist costs. So for most of us, we'd go to a specialist a couple times a year. If it's a $30 copay, it's $60. It's not a huge cost. Knowing the deductibles, most Medicare Advantage plans and most of our markets that we market into and help Medicare beneficiaries have zero deductibles for Part A and Part B services. Most of the time, you have zero deductibles for your prescription drug plans. Medicare Advantage plans normally are built on a deductible-free chassis model. So there's not going to be usually a deductible involved in your plan. But knowing that, understanding that, knowing that each year that they can change some benefits, and understanding that if you have a licensed professional like us, or a licensed agency that specializes in Medicare health plans, you can call in and just say, hey, is there any major changes to my health plan? And you can talk to a customer service person that's going to walk you through answering quick questions, or talk to your actual agent that that helped you the year before that. You talk to a licensed professional that you have an ongoing relationship on, and you ask those key questions, or we reach out and let you know. And then the last thing on this is just understanding the copays and out-of-pocket max. The out-of-pocket max that often you hear me say is from zero, of having nothing out of your pocket for access to care, up to a max. And usually that's going to be anywhere from about $3,000 to $5,000 or $6,000 max. So a lot of times people will say, hey, I'll self-insure, I'll take that money, put it in a savings account. If I have a catastrophic year, I get ran over by a train, a bus, I'm attacked on the subway, I'm beat up 5 times, I'm in the hospital, I have chronic illness, and I'm in the hospital 5, 6, 7, 8 times throughout the year. I have 3 different outpatient surgeries done, and I have all this preventative and routine follow-up from specialists and therapy and things like that. Is that going to happen? Probably not. Has it ever happened with anyone that I've ever helped enroll into a Medicare Advantage plan? No. But what has happened is people have gotten cancer, and cancer has a chemotherapy 20% billable rate for chemotherapy injectable drugs. So if they don't have a separate rider to cover the cost of that 100%, they're going to have some out-of-pocket max, and they could hit that maximum amount. The rarity of people hitting the max is very small and limited, but you need to be prepared for that. And then the last thing is look beyond the basics of the extra benefits and hidden costs that the Medicare Advantage plan could have. The extra benefits are going to be the things that you see advertised. The dental, the hearing, the vision. I'm going to have my Part B premium bought down. So I'm going to call this 800 number to somebody I've never talked to before, as opposed to this licensed professional agency that does this year in and year out, like our agency or an agency maybe you're working with now. Understand how the extra benefits work. Do you have dental, hearing, vision, over-the-counter benefits, a gym membership? These extra benefits that are embedded into Medicare Advantage plans can be tremendous benefits. They can be great. They don't always answer every question, I always say they're managed within the health plan. Sometimes they're administered by third parties, and those third parties will have a network. So accessing the dental benefit may involve a network. And if you have somebody that's licensed and guides you through explaining how the benefits work, guess what? The benefits are great. If you don't, guess what? You're going to be confused and frustrated. And then you're going to be asking a lot of questions about, why did I enroll in this? I can't even access my dentist, or I can't use this benefit. You need to understand and make sure you understand those extra benefits. And the last thing I was saying, the hidden cost. Really, the hidden cost, there's not any hidden cost if somebody walked you through the complete summary of benefits of the Medicare Advantage plan you're choosing to enroll into. The hidden cost issue will come up if the agent is just very generic and goes over just the basics with you and just says, hey, you're going to have some copay cost. Well, what kind of copay cost? Because you need to know what those costs are. Now, the last thing before I let you go and then see you on the other side with our other video and content is, hidden costs a lot of times will happen like this. You're going along and you've gone to a primary care doctor, maybe a specialist, and that's really all the access of care that you've had. So when we enroll somebody, we often say, you're only going to really remember what you're using right now. Like you're going to the dentist, you're going to get your hearing checked every year, you get your eyes checked every year, and this plan covers that. That has really great benefits for that. You're going to a primary care doctor, you're going to get your woman physicals and annual examinations done, or you're a man, you're getting your physical examinations, your prostate screenings, your colonoscopies, things like that are preventative services done. And you're going to a primary care doctor and you go to a specialist just to get a checkup on a heart condition you had 10 years ago, and you go once a year for a routine follow-up. You don't really have a lot going on. Then fast forward and all of a sudden you do have stuff going on 4 or 5 years later, and all of a sudden you have a $300 copay for an outpatient surgery, and you have a $10 copay for physical therapy over 12 sessions, so $120 copay worth of physical therapy. Now all of a sudden you do have some costs going on, and a lot of times people will go, I didn't know I was going to pay this. And again, this relates back to the relationship that you have with the agency that you're working with, or the agent. And if you have a professional agency that's working with you, they're going to educate you and keep you informed about what's going on in the world of Medicare and your health plan options and what your costs are to eliminate these hidden costs. Guys, if you've not subscribed, liked, or shared our content, please take a second to do that. I will be diving into some other essential tips for you to understand about Medicare in our upcoming videos. Take the time, share, like, and I'll see you on the other side.